In this video, we will discuss about the skeleton of the head and its individual bones. The human skeleton, it is of two types. That is, one is the axial skeleton, other is the appendicular. In axial skeleton, we have a skeleton of head, neck and the trunk. In appendicular skeleton, the skeleton of the upper limb and the skeleton of lower limb. Now, this is the skull which has 22 number of the bones excluding ear ossicles. These 22 number of the bones, these are attached to each other by the sutures or the fibrous joint. So, it makes them immobile. Only this joint is mobile. And this is known as the cranium. So, mandible plus cranium is known as the skull. Now, skull, it has two parts. First is the cranium or the cranium or cranial skeleton, which form the brain box or cranial cavity. You can see this is the cranial cavity. We have removed the dome or vault of the skull. It contains brain, so we call it brain box. Fine. And this is the vault which we have removed, so it contains brain or brain box, or we call it calvaria. What? Calvaria. Now, second is the facial skeleton, in which the mandible is there. So this is the facial skeleton. Only this joint is mobile. In routine daily study purpose, this cranium is also called as the skull. Fine. And what is the function of skull? So you can see skull contains the brain, it protects the brain in the cranial cavity, and we have a spatial senses, that is the eye for eyes, for smell, and for the maintenance of the equilibrium, and for the taste. All the senses are there, and it also has the passages for the air and for the food. So these are the important points. Now come to the individual bones of the skull. You see, we have a paired bones and unpaired bones. So in case of unpaired bones, this is the frontal bone, fine, and which is unpaired. This is the occipital bone, which is posteriorly. So this is the occipital bone, which is again unpaired. This is one important bone, which is the sphenoid. It forms the base of the skull. You can see it's a butterfly shape. It is also unpaired. And this is the very small delicate bone, and which contain number of air sinuses. This is the ethmoid bone. So these are the unpaired bones. And one more bone, that is the vomer. You can see this diagram because we don't have vomer. So this is the vomer bone, which form the medial wall of the nasal cavity. So this is the vomer bone, which is unpaired bone. Fine. Now come to the paired bone. So when we start from the very small bone, you can see this is the nasal bone, right and left nasal bone. This nasal bone is located here, forming the bridge of the nose. Then these are the two palatine bones, again paired bone, right and left. They form the palate or hard palate. Here you can see. And then we have a maxilla. This is zygomatic bone. These zygomatic bone, they form the prominence of the cheek. So this is the zygomatic, which form the prominence of the cheek. So paired bone. Then come to the maxilla. These two maxilla, which form the upper jaw, and the important largest bone of the facial skeleton. So this is the maxilla, which is paired bone. Then you come to the temporal bone. these right and left two temporal bones, they form the boundary of the cranial cavity. So this is the temporal bone, or you can see in this skull. So this is the temporal bone. Now other is the parietal bone. These are the two parietal bones. Again it forms the boundaries of the cranial cavity and the vault. Vault means the skull cap. Fine. So these are the two paired bone. One more bone which we don't have, that is the lacrimal bone and the inferior nasal concha. So in this diagram you can see this is the inferior nasal concha. This is the projection of the wall of the nasal cavity, lateral wall of the nasal cavity. So we have two inferior nasal concha and the lacrimal bone, two lacrimal bone. Fine. So these are the paired bones. Now, how will you identify the side? Whether it is right side, it belongs to the right side, or it belongs to the left side. So important bone which commonly asked or we discuss. So first you go to the maxilla. This maxilla belongs to the right side because this is the teeth bearing area, it should be downward, and this is the projection, we call it frontal process, should be upward. This is the zygomatic process, should be laterally, and this projection on the medial side, and you can see on the medially there is a bigger sinus, maxillary sinus, so it should be like this, and this belongs to the left side. So you can make the difference that it belongs to the right side and it belongs to the left side. Now one more important bone is the temporal bone. You see this is the zygomatic process of temporal bone, squamous part of the temporal bone. So zygomatic process should be on the outer side. Squamous part or a thin plate-like structure should be upward. This strong petrous part on the medial side, and the posterior, you see this is the mastoid process. So it should be posteriorly. Fine. So this belongs to the right side, and you can see again this is the left side bone. Zygomatic process outer side, squamous part is on the facing upward, the mastoid process posteriorly, and petrous part medially. And if you see inferiorly, so this area should be inferior. There is a fossa. This is the mandibular fossa where the head of mandible attached. Make the temporomandibular joint. So it should be inferiorly. So it belongs to the left side, it belongs to the right side. Now come to the parietal bone. These are the two parietal bones, right and left. Here you can see this bone is almost quadrangular plate-like bone, and the outer surface facing outward or laterally, this is convex. Fine. This is the superior border, anterior border. It is extended. It forms the anterior-inferior angle, and this is the medial surface. You can see a groove. This groove is for the middle meningeal vessel. So it should be medially, and inferiorly there is a convexity. The inferior border is concave, and posterior inferiorly you can see there is a groove for sigmoid sinus. So this belongs to the right side. Same you can this is on the of the left side. So anterior inferior angle, this is the groove for the middle meningeal vessel. Anteriorly, posterior inferiorly there is a groove for sigmoid sinus. The medial surface is concave, or the lateral surface is convex. Inferior border is again concave. So this belongs to the left side and this belongs to the right side. And now when you study or you discuss, you should always in its right parietal bone in the right side, left parietal bone in the left hand, or right parietal bone in the right hand to hold. And this is the smaller bones. This is the zygomatic bone. If you see it from the inferior boundary of the orbit, inferior or lateral boundary. Fine. So you see this is the smooth surface, which should be outer side, and this is the frontal process of the zygomatic bone. This is the maxillary process, and this is the temporal process of the zygomatic bone. So this belongs to the right side, and here it belongs to the left side. You can see the smooth surface anteriorly, frontal process, zygomatic process. Fine. Or posteriorly you want to see, this is like this. So it should be on the posterior side, smooth surface is anteriorly. This belongs to the left side. Nasal bone, these two nasal bones, the medial border is straight while the lateral border is slightly not straight, because these two nasal bone they form the plain sutures. So these the inferiorly they are broad, superiorly this is the narrower. So it is like this. You can see in this belongs to the left side. Fine. Now this is the palatine bone. The palatine bone, it has a perpendicular plate and a horizontal plate. The perpendicular plate and the pyramidal process. See, the perpendicular plate should be on the medial side, or the pyramidal process on the lateral side. So this belongs to the right side, and this is the bone which belong my left side. So I am holding it in my left hand. So these two bones, these are the two bones, palatine bones. So this is the horizontal part, and the perpendicular plate is inside. Fine. So the lacrimal and the nasal concha we don't have. So this is regarding the side determination and the differentiation of individual bones. Thank you.